Hi guys, my name is Stephanie, and today I'm going to be presenting to you what ventilator-acquired pneumonia is. First off, patients who are hospitalized and placed on mechanical ventilation for longer than 48 hours are at an increased chance of developing ventilator-acquired or associated pneumonia, also called VAP. VAP is a form of nosocomial infections with recently reported rates that range from 1 to 4 cases per 1,000 ventilator days. It is considered one of the most serious and is the leading cause of morbidity and mortality from device-associated infections, especially in the intensive care unit. There are some interventions that can be done to potentially reduce the number of VAP cases in the ICU, such as keeping the intubated patient in a semi-recumbent position or 30 to 45 degrees with the head of bed elevated. You can also provide appropriate hygiene when you're doing their ET suctioning, and then using chlorhexidine as their daily mouthwash or oral care. Today, my PICOT question is in ICU patients. How does the use of intraoral chlorhexidine versus not using intraoral chlorhexidine affect ventilator-associated pneumonia within 48 hours? First of all, what is ventilator-associated or acquired pneumonia? It is pneumonia that occurs more than 48 hours after patients have been intubated and are on mechanical ventilation. It can be diagnosed through bedside exam or chest x-rays and microbial analysis of respiratory secretions. Some statistics of ventilator-acquired pneumonia is it affects 27% of all critically ill patients. 86% of the nosocomial pneumonias are associated with ventilator-acquired pneumonia. 250,000 to 300,000 cases per year, or an average of 5 to 10 cases per hospital administrations, end up being ventilator-acquired pneumonia. The mortality rate of VAP is a little broad. It ranges from 0% to 50%. During my research, I used Cynol, and I used the phrase ventilator-acquired pneumonia. I searched oral care, and then I searched with them combined with ventilator-acquired pneumonia oral care. That is where I found all of my research and my articles for my capstone project. I will be emailing you my evaluation tool, and if you could please fill it out and submit it back to me, I would really appreciate it. Thanks a lot, guys.